without further ado, again, thank you for joining our webinar on special enrollment periods. Our presenter today is going to be Alexandra Doe, who's a policy analyst here at Access Health. So, Ali, I'll let you take it away.
Great, thanks, Quinn. Hi, everyone. Thank you again for joining today for our webinar about special enrollment periods for this plan year, 2018. So for our agenda today, we're going to go over a general overview of special enrollment periods and how they function, review some of the qualifying life events that we recognize here through Access Health CT, talk about the pre-enrollment verification process, just briefly run through a summary of some of the effective date rules, and then we will take some questions at the end. And as Quinn mentioned, please feel free to type those questions into the chat box as we go. So for those of you who haven't been certified with Access Health before, I know some of this might be new information. For individuals who have done this year over year, you're going to be familiar with most of the overview information. So special enrollment periods, which I'll note don't just exist inside of the exchange. So Access Health CT is not the only entity that recognizes a special enrollment period. These are a function of the insurance market, whether you have employer-sponsored insurance or you're an individual outside of the exchange. So these are a period of time outside of our regular open enrollment period where qualified individuals, and we'll talk about what qualifies them, can obtain coverage when they've experienced a qualifying life event. So we classify qualifying life events as changes in circumstance that impacted individuals' eligibility to purchase coverage through the exchange, or an impact to their ability to qualify for financial help based on their income or their household size. These may also impact the eligibility of someone's dependent, which I'll talk a little bit about the details, between when the primary applicant qualifies for a special enrollment period or if a dependent qualifies for a special enrollment period. So we'll get into a little bit of that. And there are some special enrollment periods that do only apply on exchange. So as I said, special enrollment periods generally exist on and off exchange, but there are some that only apply to current exchange enrollees. So we'll get into some of the types of qualifying life events. So the first is probably the one that I would say that we see most often here at Access Health, when an individual comes to us and attests to having lost their minimum essential coverage, whether it's through an employer or through some other type of plan that they have. There's also individuals who age off of their parents' plan, for example, under the AHCY. Children and qualified dependents are allowed to stay on their parents' plan through their 26th, or through age 26, I should say. So when those individuals lose their coverage, they're typically notified of it in advance, and they can come to the exchange either within the 60 days before the end date of their coverage or within the 60 days following the end date of their coverage. So if their plan ends on January 31st, they can come to us anytime during December or January to sign up for a plan, or they can come anytime during February or March to say, my plan ended and I need to come on and get another plan. So this household changes qualifying life event kind of covers a lot of different things that can occur, that can happen within a household. We at Access Health in the application, each of these are separate selections that I know that they exist at different points in the application, but they include marriage. So whether one individual is already enrolled on exchange and they get married to someone who is not enrolled or has coverage somewhere else, they can help go through the steps to add that person to their on exchange or Access Health policy. If two individuals who do not have coverage get married, they also have the option to come on exchange based on their marriage, but there's a prior coverage requirement that they must meet, and I'll talk about that a little bit more in the verification process. So we also have birth, which would be an addition of a dependent, adoption, placement for adoption or foster care, gain of a dependent, or the death of a dependent, or the death of a primary applicant, which I know that last one, people, those of you who have been with us for a while know that has been kind of a sticky process in the past, but we've taken steps to kind of iron out some of that. And all of the, actually, I know that just the first 4 on this list require pre-enrollment verification. So next we're going to talk about changes in eligibility for financial help. These include the gain or loss of eligibility for tax credits, so premium tax credits, or cost sharing reductions. These SEPs are only available to those currently enrolled on exchange. And in our system, these individuals will be able to make changes to their current plan. So they can come on and if they are at the silver level, for example, if they gain, or let's say they're at the bronze level and they gain eligibility for cost sharing reductions, they'll be able to shop up into a silver plan so that they can take advantage of those cost sharing reductions that previously weren't available to them based on their income. These do not require pre-enrollment verification because we will use the standard kind of traditional income check to, well, we will open that verification to check that those individuals can prove their income and that they are in fact eligible for those types of financial help. So everyone's favorite topic is immigration status, and citizenship is in there as well. So individuals who experience a change from one immigration status to a lawfully present immigration status may be eligible to purchase coverage through Access Health Connecticut. And it's important to remember that this means that previously the individual did not have a lawfully present status. And for the purchase of qualified health plans, individuals need to have a lawfully present status. And I just want to make sure that everyone knows, you know, our distinction between lawful presence and lawful permanent residence. So for Husky and our Medicaid program, individuals must be lawful permanent residents for at least 5 years in order to qualify, but to purchase a qualified health plan, they only need to be lawful, and I don't mean only, but they need to have a lawful present status and intend to reside in the United States for the entire year. So for example, if they go from having no documentation or no valid immigration status, or a type of immigration status that doesn't entitle them to purchase coverage through the exchange, for example, if they were previously, and again, I know this is a hot topic for example, but if they were an individual who was here under the Deferred Action for Childhood Arrival status, they're not eligible to purchase on exchange or receive tax credits, but once if they were to then gain an eligible immigration status, so if they became a green card holder or they gained a visa, a different status, then they, upon receiving that status, they would be able to qualify to purchase a QHP. So this qualifying life event does not require pre-enrollment verification. And again, because we verify immigration status through traditional verification, our verification checklist process. Just a short note about American Indians and Alaskan Natives. These individuals do qualify for a special enrollment period once per month, so they can make changes to their coverage once per month. It doesn't require pre-enrollment verification because, again, we verify this information through our traditional VCL process. And I hope that everyone has seen this handout that you see on your screen. This is available in the application when an individual attests to experiencing one of the qualifying life events that requires verification. So we're going to talk a little bit about the parts of this notice and the information that's contained in it. So as I mentioned before, these qualifying life events that you see here do require pre-enrollment verification, marriage, birth, adoption, or fostering a child, a permanent move to Connecticut, or a loss of coverage. And I know we didn't get into permanent move earlier, but I can talk a little bit more about what the requirements for that are as well. So these are just some excerpts from the notices that individuals will receive throughout the course of the verification process. So similarly to how traditional VCL works, on the top left corner, you'll see the cover sheet that we have there. And this is from a template that we use, so that's why most of these are just out of the templates that we have in the system. But it says, you must include this cover sheet for all of the documents that you send. That's the only way for us to attach documents that are submitted to an individual's account. Some of these other paragraphs just show some of the language that they'll see in our notices. So the orange box is where we will request documents and provide later on in the notice, it provides the dates and deadlines. There's also when you are attempting to submit documents, how you can do that at the bottom. And then on the right side, the verification successful notice that will say, you know, we have completed and released the enrollment for this household member and this household member. One thing to note is that if individuals, and I think this might be in a later slide, if individuals attest to more than one qualifying life event that requires verification, they only need to verify one, and typically the system will assign the earliest coverage effective date. That was the intention when it was designed that way, and we run into some issues with assigning the correct coverage effective date based on the verification item, but it's a relatively easy fix once someone has verified their documents. So they will also get a notice with a different orange box that will say that the documents submitted were not sufficient to verify the qualifying life event. And typically this indicates that they still have more time to submit their documents, but depending on when they sent them and when we're able to process them and deem them not sufficient, they may see all of these notices kind of in quick succession because the period of time for verifying is only 30 days. And then at the very bottom, there is an example of what it will look like when an individual has failed to verify their qualifying life event. So as I said, the pre-enrollment verification process is a 30-day period for qualified individuals who attest to a qualifying life event. They will receive a notice shortly after their enrollment, similar to their traditional eligibility notice, and they should follow the steps that are contained in the notice. Again, if they have more than one qualifying life event, they only need to verify one, and we do our best to ensure the earliest start date that is programmed into our system. And if verification is required, the enrollment is not complete until the documents have been processed. And what this means is there's no active coverage for this individual until they have verified their information. And really, our participating carriers aren't even aware that an individual has come onto the system until they've verified their documents. So if they receive their eligibility notice that states what plan they picked or anything like that, if one of the other verification notices, if this special enrollment verification notice comes through, that will indicate to them that their coverage is not active yet. So this is just an overview of the documents that can be submitted. And again, I'll talk a little bit about why it's important to prove prior coverage. So for marriage and a permanent move to Connecticut, individuals have to show that they had coverage for at least one day in the 60 days before before the event occurred. So if the date of the marriage is June 1st, and both individuals are coming on exchange and haven't been enrolled before, they're going to have to show, just one spouse, but is going to have to show that they had coverage within the 60 days before the marriage. And if it is the case where an individual who is currently enrolled on exchange would like to add their newly wedded spouse, they actually won't have to meet this requirement because our system recognizes that there was someone already enrolled. So they have already automatically met that requirement. For a permanent move to Connecticut from another state, individuals must also show that they had health coverage in that same 60-day period for at least one day. And we've listed out here some of the documents that we would require and accept. Again, this is available on our website, and also it's available to individuals in the application. So I just want to make us a note about our 30-day verification process versus what I've referred to kind of as our traditional VCL process, or our traditional verification checklist process. So when individuals, or applicants I should say, come on and attest to a number of different things in their application, like their income, their family size, their tax filing status, things like that, those facts go through a 90-day verification process. And I'm certain that everyone is familiar with this. But But if they only have those things, like for example, our applicants and consumers that came through the system for open enrollment in November and December, they will be in the middle of their 90-day verification period right now. But an individual who comes on for a special enrollment period and opens a 30-day verification period, both of those timelines, and we've tried to kind of represent it visually here, begin on the date of the enrollment, and they run parallel to one another. So the first 30 days of the 90-day verification period is also the time in which individuals have to verify their qualifying life event. So it's important to just kind of make sure that people are reading the notices that we're sending and understanding what types of documents we are requesting, because for those who enrolled, for example, during open enrollment, and they have a 90-day verification requirement that they have to meet, their coverage is actually active on January 1st, whether or not they verified, but by the time when that 90-day period is up, that's when their coverage is terminated if they have outstanding verifications. And I know that can be a little confusing and that the notices are not always clear, but it is a requirement that both of these kind of timelines run parallel to one another, and we just want to make sure that everyone's aware of the two different types. So I'm going to talk just kind of generally about some of the effective date rules. Individuals can or will be made aware of what date their coverage will be effective, especially in the case where they have a verification open. It will be listed on the eligibility notice and also on their verification notice if they are required to verify their SEP eligibility. So I'm not going to get into all of these details, and I think that this is a piece of information that probably, if you're familiar with our team, I think Helga has put this out a few times. So you can go to the next slide, because there are just a couple of different effective date rules. Some of them follow this 15-day rule. Some of them follow the first of the month following rule. And again, we have made this information pretty widely available, but are happy to also put this out with the webinar too as a material.
Great. Thank you, Allie. That was very helpful information to me, and I know that she covered a lot of ground. So just wanted to remind everybody that we will be emailing the deck out to everybody following the presentation, and we're also recording this so that you can watch it over again as well. Before I move forward and talk about the opportunities to partner with Access Health Connecticut, if you have any questions, please type them into the chat box, and we will move forward with the Q&A process after these next few slides. So I see a lot of familiar names on our attendees list right now, and thank you so much for being an Access Health community partner over the years. I know some folks on here are CACs who have been enrolling with us since year one, and others work with community organizations that whose mission align with Access Health. So what is a community partner? Partners help Access Health share information about health coverage and access to affordable health coverage with communities all across the state. We can only do so much, but with your help, we're able to cover a much wider spread across the state. This is a map of our community partners, and we're always looking to expand that. So if you are new to Access Health and you want to figure out, hey, how can I get involved, please reach out to us following this webinar. So here are some of the ways that we can be helpful to you. We have a great team of outreach staff here that is willing to speak at any events you have. If you have any tabling sessions or informational sessions, speaking engagements where your staff or your constituents would like to learn more about Access Health, we're happy to come talk to you. If there are any events in your community, we're planning for our outreach tour in 2018, and we're always looking for events to be at. So please let us know. There's going to be more webinars like this one. If you're on our mailing list, and please do sign up for our mailing list. We send out regular notices about the upcoming webinars and other educational opportunities for our partner. We have a website. Our community page is wholly devoted to our partners And on this page, you can find information about our upcoming events, links to our newsletter. That's where you can go to sign up for our newsletter. We send out a monthly newsletter and some emails in between if there is any relevant information we feel like we should be sharing with you. That's where you'll also find our resources, our printed materials, and contact information for various Access Health departments. Some ways that we're looking for you to help us, like I said before, spreading information by placing a poster or any brochures. We distributed a lot of open enrollment brochures, but we also have similar brochures for special enrollment. So let us know if you need any of that, and we'll make sure to get it to you. We might periodically ask you to send notices out to your members if there's an important notice coming up about Access Health. And on our website, you'll also find our logo if you want to include that on your website and link to us so that your members and people who visit your website can learn more about Access Health by going directly to our site. So I've talked about this very briefly. We're always looking for speaking engagements. We're always looking for events. If you have any suggestions for us, please email us at outreach@accesshealthct.com. And one thing I should mention is the planning sessions, that last bullet there. Every year in between open enrollment periods, we want to gather our partners into a room and talk about, hey, what did we do well this last open enrollment period? What are you looking for us to do in the upcoming year? We want your input, and that will help us plan what we do throughout the year. So that's going to be coming up in the spring. So please be on the lookout for that. We're going to have several across the state, and we hope that you can join us. Again, this is just talking about the resources that I already mentioned on our community page, which is learn.accesshealthct.com/community. If you are looking, or any of your members are looking for where they can find in-person help, that's support.accesshealthct.com, and there they can find a list of brokers and CACs in their area. Again, please sign up for our monthly newsletter. You can do that at the community page, like I mentioned. And the last thing I want to mention is there's a Contact Us tab on our community page, and that will direct you where to go depending on the questions that you have. If it's about outreach or webinars or events, you can contact Kelly Kennedy, who's our Community Affairs and Outreach Manager. Her phone number and email is up there. If it's a question about an Access Health plan, or if it's a question about plans through Anthem or Connecticut, that's where you'll go and you'll find the appropriate contact information there as well. So I'll leave this up on the screen a little bit if you want to jot down our phone number and our email address. Before I go any further and take any questions that we have for Allie, I want to, Grace is going to post a survey link for you momentarily. Please take just a couple minutes to fill out this survey. It really helps us to see what we're doing right, what we can improve on, and get your ideas in terms of what webinars would be helpful for you in the future. So Grace is going to post that up right now, and we will move on to questions. So Allie, we got some questions before the webinar started today from some of our participants. So the first question we have for you is, how does special enrollment periods work for Husky individuals who are over income?
And I just want to take a second just to thank you for everyone who typed in questions to the chat box and individuals who responded to us before the webinar. It's really helpful to get questions before we hold these kinds of webinars so that we can dive a little bit deeper into some of the questions if we need to. And we could also make sure that we're including that type of information in other webinars or publications or anything like that. So I know that there have been eligibility changes for income levels for Husky over the last couple of months. And SEP will work for Husky individuals automatically. So someone whose eligibility changes for Husky in our system is, for example, if they come in and they report that their income has changed, those individuals are not going to have to verify or submit any documentation showing that they lost their Husky coverage because of their income. So typically what will happen is they'll come in, they will change their income, and again, this is a this is an oversimplification of the process, but I just want to make the point that they will come in and report the change to their income. They'll receive a notice stating that, based on that information that they're provided, that their husky will be ending, and then they'll be able to come on within 60 days of the end date of that coverage to be able to pick a qualified health plan if that is what they so choose to do. There are other eligibility requirements that have changed, and I believe it's Husky A program that the thresholds changed. And I know that, or whether that has happened or it happens in the future, Husky individuals become eligible for TMA, and that's administered through the Department of Social Services. So they would receive information from the Department of Social Services about that coverage. And then individuals who have changes for Husky D do not receive TMA. So they would, again, they would be engaged in this kind of automatic process where the eligibility for them would change, and they would receive a notice that says what the end date of their coverage is based on that change, and then they could come into Access Health without having to verify that their eligibility has changed. Now, that's not separate, or that is separate and apart from whether or not they will need to verify their income, but that would be through our traditional VCL process. So it's a little sticky. There's a couple different rules about this, but the important thing to note is that typically they don't get engaged in the 30-day verification process, since the Husky system and our QHP eligibility system talk to one another. So they are eligible for a special enrollment period if they receive a notice that says that their Husky coverage is ending.
Okay. The next question we have is, can those who leave work voluntarily qualify for a special enrollment period? And I think, Peg, that is similar to the question that you had just typed into the chat box just now.
So that's a really good question. And again, this is a perfect example of getting questions in advance, because I was able to follow up with some of the other members of our policy team. So for an individual who voluntarily leaves work and they were previously receiving an employer-sponsored plan, they are eligible to come on for a special enrollment period based on the end date of that coverage. So typically if they leave their job, or if they are laid off from their job, but if it is a voluntary departure, they can come and tell us about having lost that coverage through their employer, and we will engage them in the loss and process for verification, and then they'll be able to enroll in a qualified health plan.
Great. Can someone who is no longer eligible for premium-free Medicare Part A qualify for a special enrollment period?
So this is a complicated question that I know that we have received through a number of different channels, and I can't say definitively what will happen to these individuals. I know that there are some individuals who participate in programs like Medicare Savings and things like that, where the requirements for those programs either change or the programs end. And those programs operate on the federal level. I know that there are some state components there as well. So we're trying to work with our partners at the federal level and at the state level to understand how our requirements need to be changed in order to process those individuals' eligibility. So we have all of these questions definitely on our radar and are working hard to get definitive answers about things like this. So unfortunately, I don't have a concrete answer for this question, but I just want everybody to know that we are trying to look into it, and we'll definitely, as soon as we have answers about these kind of things, definitely connect our CAC communities to resources about that.
Great. Allie, here's a question from one of our participants. Michelle asked, after losing their CHIP coverage, why are children not receiving tax credit toward their QHP?
So I think that this is in reference to what's currently going on with CHIP eligibility, but our system currently is designed in such a way, and I don't want to claim to be an expert about CHIP eligibility, because this is really something that the Department of Social Services would be more well-versed in. But in terms of our system, if family members qualify for a qualified health plan to purchase one, but they have children that are on CHIP, and I'm talking traditionally, so when the children still qualify for CHIP, those children are not calculated in, or there is no tax credit attributed to those children. Now, if their eligibility changes or there are changes made to the program, where those children will no longer be eligible for CHIP, in theory, they would be added into the calculation for tax credits, but if there is a system issue that anyone seeing where they're no longer being granted CHIP eligibility, that's something that they should definitely reach out to us about and let us know if they're seeing a trend where those children are no longer eligible for CHIP and are not being calculated in.
Seems like I have one more question here, but I want to ask our participants again, if you have any questions, please type it into the chat box and we'll add that to our list. Ellie, do we know what the timeline is for the 6th open enrollment period, so for the 2019 plan year?
That's a really good question. And, I think that we can plan for it to be similar to this year, but I can't say definitively what it will be. Previously, the Affordable Care Act did shorten, so it stipulated that open enrollment periods for, I think it was years 1 through 4, would be extended open enrollment periods. And then as the exchanges became more well established and because the purpose of having extended open enrollment periods was so that individuals who had not previously interacted with an insurance program or had never had coverage could kind of come on and get a feel for what they were doing and not be limited to perhaps just a month or 6 weeks of opportunity to come on and get a plan. And I think the concept was that year over year, this ability to be able to kind of come on and pick a plan and be settled into that would improve as our outreach improved, as education levels improved in terms of insurance and health insurance literacy. So the plan previously was for open enrollment periods to shorten a little to the 6-year timeline that we have now. So I don't want to say definitively that it will be whether it's an extended as it has been in years past or whether it will mirror this year. But we will definitely put that information out as soon as we have a confirmation, which is difficult to say when we will get it these days.
Great. So we'll give it another minute just in case anyone's thinking through any questions, and if you do, please type it in the chat box. You'll also notice in the chat box that Grace posted the link to our very quick survey. Again, please take a minute to fill it out. It is immensely helpful to us as we plan on future educational webinars for our community partners. All right, seeing no other questions, thank you very much again for joining us today. We will send out the link to the presentation as well as the recording within the next week or so. If you have any questions about any of this or about outreach in general, please shoot us an email at outreach@accesshealthct.com. Otherwise, thank you and have a great day.